Hometown. According to the CDC, 8.6 million sports and recreation injuries were reported in 2018. Joining me today to discuss injuries and prevention is Dr. Babar Sultan, who is a board-certified physician who specializes in sports and family medicine. Dr. Babar, thank you so much for being here.
Thank you very much. Glad to be here.
So sports medicine is not just for professional athletes. What are some of the common injuries that you treat in your practice?
I think that's a great question to start out with, because that's a question that a lot of people have on their minds. Just to give you just a little bit of a background and a story, a couple of years ago at the AMSSM, they had a sort of a bucket where everybody put in their opinions, and the question was, what is sports medicine? What I put in there was that sports medicine is a misnomer. And that's true up to a certain point, because when patients think about sports medicine, they think about care that professional athletes or those that are heavily involved in sports needs. However, sports medicine is not just for athletes. You know, anyone that's physically active or has an injury that involves the musculoskeletal system would be a patient that would be glad to take care of at sports medicine. Because as far as we're concerned, an ankle that is broken by an athlete is identical to the ankle that's broken by someone walking down New York City, is identical to the ankle that's broken by someone that's walking down the stairs. We're going to treat that as an ankle fracture, and the same goes for all other injuries. We treat the injuries regardless of how they occurred.
And how do you evaluate an acute injury?
One of the most common things that we look at when evaluating the injury is the mechanism of the injury. And that's why we have physicians and athletic trainers on the sidelines to try to see how that injury occurs. And if you go into your sports medicine physician's office, one of the first things they're going to ask you is, well, what happened? Which way, and going back to the example of the ankle, which way did the ankle twist? Where does it hurt? What have you tried at home so far? To give us some insight into what may be going on underneath. After we have an idea of the history, that's followed by a physical exam, where we notice things that are on there, may involve some range of motion and pressing on that ankle, which again, I apologize if it causes pain, but I'm doing that to try to get as much information about the nature of the injury so we can treat it better. Oftentimes, we need some imaging studies, such as an X-ray, to get some information on there. And in very few cases, we may actually need imaging studies beyond an X-ray. In a small portion of our patients, we may eventually follow that up with either a CT scan or an MRI scan so we can get a better idea of the nature of the injury.
So acute injuries include sprains, strains, and fractures. What is the difference between them, and how do you treat them?
That's a great question. So, oftentimes when patients come in, they have an idea of what's going on, but that's one of their questions. Did I strain it or did I sprain it? And essentially, strain, sprain, and fracture, think of them as disruption in three different organs. A fracture, as most people know, is a broken bone. So when a bone breaks, that's a fracture. However, all bones are connected to other bones by ligaments. And whenever you have either a partial or a complete disruption of that ligament, that will be called a sprain. And then we have tendons. Tendons are what connect muscles to the bones. They're the ones that are responsible for movement of bones across all joints. And those are connected to bones via tendons. And whenever you have an injury of that complex, that will be called a strain. So essentially, it depends on which structure is injured.
And how do you prevent these injuries?
Mechanism of injury, as I was going back to a little bit earlier, that's one of the most important things when it comes to injuries. And oftentimes we would see, and we see this more frequently in athletes, we will see something that they're doing wrong that we know is going to lead to an injury. And oftentimes when they come in and after we discuss this, we tell them how they need to change their activities to make sure that they decrease the likelihood of their injury. We can never decrease that risk to zero, but we want to do our best to minimize that risk as much as we can.
Acute injuries, or injuries in general, are usually affiliated with some sort of pain. Given the opioid epidemic that is going on, are you conservatively giving pain medications or prescribing pain medications? What is the treatment for acute injuries as far as prescription medications?
So again, I think that's another great question, because right now our country is going through an opioid epidemic. And one of the reasons for that opioid epidemic was because their mechanism was poorly understood by the general public and physicians alike. And because of that, that led to lowering of the threshold for when we were prescribing opiates. You know, being a sports medicine physician, almost all of my patients that come in are complaining of one or different types of pain. And in the last year, the number of patients that have walked out with an opioid prescription is probably 10 or less. Because that's where sports medicine comes into play, where we're not just going to give you something to try to mask that pain. However, if the pain is severe enough that you need some masking for short term, we can use pain medicine, and that, if it's severe enough, may include opioids. But what we do is we try to identify the underlying cause of why you are having this pain, what was the injury that led to it, and try to fix that. So that way, hopefully, we can continue to decrease the number of times that we have to use opioid prescriptions and stay away from the risks that they come with.
And the underlying causes, as you mentioned, most of the injuries seem to have a common denominator, and that's inflammation. How do you treat inflammation? What role do steroids play in treating these injuries?
Inflammation is something that presents with almost all injuries, and that's essentially body's way of responding to every time something goes wrong or something that shouldn't be the way it is. And some of the signs of inflammation include swelling, include pain, include loss of function, includes redness, includes fever, right? So, or when I talk about fever, I'm talking about local warmth and local fever. And those are the signs of inflammation. And then whenever we see that, we know something's wrong there. And then that starts my job as a physician to figure out, well, what's wrong and what we need to do. Now, steroids, corticosteroids, not anabolic steroids, corticosteroids are an important tool that we use to fight inflammation. If the inflammation is bad enough or we feel like that we need something stronger, we will use steroids. But again, we're trying to reduce the inflammation. At the same time, we're trying to figure out what were the underlying reasons that led to that inflammatory process and hopefully reduce the recurrence rate.
Running is a great form of cardio exercise. Running is often affiliated with bad knees. Is there any research behind that?
Yes, there is some research behind that, but I want to break that question up into two. There's some research on before you get arthritis and the effects of running on that. And research for that is a little bit mixed. Some studies show that running may actually even protect the knees. Some studies have shown that it's likely to increase the risk of arthritis. So before you develop arthritis, the impact of cardio or running is not clearly defined. However, we know from research that impact activities, particularly running, once you get arthritis, increase the likelihood of you developing symptoms. So in my patients who already have knee osteoarthritis, we tell them to avoid impact activities and try for non-impact cardio, which may include a stationary bicycle, and if they like that motion of running, they can even do something like an elliptical.
And do all sports injuries require surgery?
Some injuries will require surgery, and we work closely with orthopedic surgeons. The scope of injuries that we treat and the scope of injuries that orthopedic surgeons treat, there is some overlap between them. If, of course, surgery is needed, as my job as a sports medicine physician is to identify that and to make sure that we initiate a referral to orthopedic surgeon. But in majority of the injuries, surgery is not needed. And in those cases, we're able to take care of those patients in our office.
What role does neuropathy play in sports injuries?
So neuropathy, it basically leads to breakdown of signals coming back from our limbs. And what that can sometimes do is that can lead to either poor proprioception or poor sensation. We know in diabetics, if they get neuropathy, they can sometimes have an injury in their foot and they cannot feel the pain from there. And because of that, that can lead to infections, and the infection can go deeper, and that can lead to more complications because of that.
Now I want to switch gears to gaming. Now gaming has soared such popularity in recent years, but it also has its downside, right? So does video games, do they cause injuries as well?
I've joked with my colleagues that the most common joint that we take care of these days is the knee because of osteoarthritis, because a lot of people walk on it, and that's the, or actually I'm going to rephrase that. So, I've joked frequently with my colleagues that the most common joint that we take care of these days is the knee because of osteoarthritis in there it can cause pain. But I've predicted that in the next 30 to 40 years, the first CMC joint, the joint at the base of the thumb, is going to catch up to the knee, and it's going to increase in prevalence. Now, we do treat a certain number of people who have osteoarthritis in that knee, but because of gaming and cell phone use and other activities that involve our thumbs, I have a sensation that the pathology of that joint is going to increase, and we're going to start seeing a lot more people with first CMC joint osteoarthritis than we're seeing in current.
That is some really good information. Do you have any last thoughts or advice on injury prevention?
That's a great question. Now, we've talked a lot about sports injuries. We've talked about all the risks that, sports can bring to you. One thing I want to emphasize is that despite all these injuries, there's still more good in sports. Sports increase the cardiovascular fitness, they improve your mood, they decrease the risk for MIs and strokes and so many other things. So don't let anything that we talked about scare you into not exercising. Exercise overall still comes with more benefits than with risks. And my job is not to scare people in not doing exercise. My job is to make sure that if they get an injury while they're exercising, to heal them as quickly as possible, to allow them to make modifications to their current regimen so they can return back to exercise as quickly as possible.
That is some really, really good information. Thank you so much. Dr. Babar Sultan, he's a board-certified physician specializing in sports and family medicine. Hometown will be right back.